Pond was an active member of the Fort Wayne Medical Society, serving as their president, and the Indiana State Medical Association Alliance. She's been involved in our AMA Alliance for over 20 years. She is a retired cardiovascular surgical nurse and is married to Dr. William Pond, an anesthesiologist in Fort Worth, Indiana. They have 4 children and 4 grandchildren. Mrs. Pond, your remarks, please.
Thank you, Madam Speaker, President McNaney, distinguished physicians. It's an honor to be here, and I bring you warm greetings from the AMA Alliance. We have a new vision and a new mission statement, a new strategic plan, which will serve to enhance our plan of work to better meet the professional and family issues of medicine. In the area of legislative advocacy, in the area of health, and in the area of education. First, in the area of legislative advocacy, the Alliance supports the efforts of the AMA and extends its reach into our communities. Legislative advocacy continues to be one of our top objectives. Of major significance and concern is scope of practice. Have you seen the scope of practice wheels? These explain the scope of practice. They're now co-branded by the AMA and the AMA Alliance, and are an effective tool to use when working with our states to enact legislation supporting high-quality, team-based care. Alliances are actively engaged at state houses across the country. We are also hosting legislative panels for our medical communities. We support your efforts to increase graduate medical education and are standing tough and speaking to our legislators. Thank you for your intervention on behalf of our international medical graduates earlier this summer, urging the agency to expedite review of pending visa applications by international medical graduates who have accepted positions in U.S. graduate medical education programs. This hits home for me. Dr. Margaret Ladowski, an enormously gifted physician friend, a Canadian citizen, and an international medical school graduate whose visa took a year, came within days of losing her anesthesia residency slot because she could not obtain entry into this country. A travesty that even a sitting U.S. Senator could not expedite. Along with the FDA and the AMA Alliance is working to prohibit the sale and marketing of nicotine and their associated delivery devices to children. Have you heard the term juuling? I guarantee your kids have. E-cigarettes, devices that typically deliver nicotine, flavorings, and other additives to users through an inhaled arsenal, are a rapidly emerging trend and are especially popular among youth and young adults. Just this week, I was at a meeting with CDC Director Dr. Deborah Owry, who said juuling is a public health concern of epic proportion. This is a bipartisan issue that all physicians and legislators can and must support. In the area of health, we have joined hands with the AMA to fight the opioid epidemic, devastating our country and killing our kids. I invited Dr. Jerome Adams, the U.S. Surgeon General, to speak at my installation last June. In his fireside chat with us, he stated that there is an opioid overdose death every 12.5 minutes in the United States, more than half of which occur in the home. These numbers are staggering and require us to act. We are using a multi-pronged approach to complement the efforts of the AMA Opioid Task Force, educating physician families and communities about the causes, dangers, and treatments for opioid use disorder, advocating for increased access to treatment for dependency and to end the stigma. Very recently, the President signed a bill into law that will expand access to care for opioid use disorder. It authorizes much-needed prevention treatment programs. This was one of the few bipartisan bills to pass the Congress this year. Bravo. The Alliance is prioritizing safe drug storage and disposal of opioids in the home. We know that more than 2/3 of opioid addiction starts in the family medicine cabinet because the vast majority of patients do not take their full prescription. The Alliance is educating on the importance of cleaning out unused and expired medications and safe disposal. We must all be responsible to get these unused drugs out of our medicine cabinets. Advocate for this and encourage your patients to do so. In the area of education, the Alliance is partnering with the National Parent Teachers Association, the PTA, to develop opioid preventative educational materials for middle school parents, as well as a teaching webinar on opioids. We look forward to debuting this meaningful project at our annual meeting in Chicago next June. We are also excited about a new documentary film from the Independent Television News Network, now under production, that features Alliance initiatives to fight opioids all across the country. And we were thrilled that Dr. Patrice Harris, AMA President-elect, described our efforts to empower physicians and communities to end the opioid epidemic, and I quote, "a policy not just on paper, but policy in action." Alliance national initiatives are our hometown heroes, doubling your efforts at the AMA to be part of the solution to the opioid crisis and demonstrating the relevance and impact of the Alliance. In addition to our National Opioid Initiative, Alliances continue to award significant medical school scholarships. I invite and encourage all MSS and RFS spouses, including male spouses, to get involved. Join the Alliance. We can be your support system through this crazy medical journey. Learn about organized medicine and become familiar with legislation. Our Physician Burnout Committee continues to be engaged. The Alliance plays an important role in physician burnout, for it is the spouse and the whole medical family who may recognize the symptoms and is instrumental in combating it. For that important reason, the Alliance educates its members and families to support physicians and encourage better work-life balance. We have partnered with the AMA to designate a National Physician Family Day each August, where our medical families make spending meaningful time together a priority, while also raising awareness to the pressures we are all under. Physician burnout affects physicians at all levels, including our medical students. Nearly 50% of medical students across the U.S. experience burnout, a problem that persists throughout physician training. Resiliency and financial planning need to be incorporated into training. Until such time, Alliances are offering free seminars on medical malpractice, contract negotiation, and financial planning for those huge medical education debts. Your inclusion of the Physician Wellness Workshop was timely and spot on. In the words of President John F. Kennedy, "Ask not what your country can do for you, but what you can do for your country." Our country needs a strong partnership between the AMA and the AMA Alliance. Let us go forward upstream, working together towards common goals to make a difference. Together we are stronger, connecting physician families for healthier communities. Thank you all for the work you do on behalf of patients and families. Thank you.
Thank you, Ms.